GCSE Biology. Welcome. Are you excited for a fun learning session? Make sure you have your book and a pen before we start. Today you will learn about antibiotics. Antibiotics. Antibiotics are medicines that kill bacteria. A scientist called Alexander Fleming discovered antibiotics in 1928. He noticed that an agar that was growing bacteria had become moldy. Around the mold, the bacteria has died. He discovered that the mold made penicillin. This became the first antibiotic. Antibiotics work by killing bacteria or inhibit cell processes. Inhibiting cell processes make them stop growing and so unable to reproduce. They do not have this effect on human or animal cells, for they are able to be used to treat bacterial infections. Many bacteria are developing resistance to antibiotics. This means that new antibiotics must be developed to help control infections. Antibiotic resistance occurs due to overuse of mismanagement of antibiotics. If a dose of antibiotics is prescribed, then the whole course should be taken. If the whole course is not taken, then some bacteria can survive due to small variations that make them better able to resistance the antibiotic. If these bacteria survive, then they reproduce and create more bacteria with an element of resistance. There are several stages of drug development. The first stage is called the preclinical stage. At this stage, the drug is tested on cells or tissues in the lab. The cells and tissues are monitored for harmful side effects. The second stage is often animal tests, to see how the drug works on the whole body. If the trials are successful, then the next stage is small clinical trials. Here small numbers of healthy people are given the drug to check for safety and side effects. The final stage is large clinical trials. Here the drugs are tested on many people who have the disease that the medicine will be used to treat. This data will be used to calculate the correct dosage needed and to monitor side effects. A medicine must pass all these tests before it is approved for use on patients.